Good afternoon. Good afternoon. Well, good evening. I believe we're at 6 o'clock. We're going to get started. If you can hear me, could everybody that's on Zoom give me a thumbs up in the background? Can everybody hear me? Thank you. All right. Welcome to our 6 p.m. portion of our open enrollment 2022 kickoff telethon. Well, we started at 9 a.m. this morning with our Get Cover Mississippi headquarters team. We went to at noon, we went to our Mid South Church's headquarters. And then at 3 p.m., we went to the Gulf Coast. We went to the Golden Triangle area. We went to the Delta. We stopped by back in our headquarters location that's located in Hernando, Mississippi. And now, as the people would say, we saved the best for last. And my name, before I go any further, let me just say my name is Thomas Robertson, but everyone calls me Duke. And I am the Technology and Metrics Director for Okia Regional Community Development Corporation. And this is my fourth year, I believe, with Get Cover Mississippi, and it has truly been a treat for me. As we move forward, you will hear from our Head Start team, and they are so ready to tell us what they're ready for this season. And without further ado, I'm gonna pass it off to our project coordinator slash Head Start liaison, Miss Berta Taylor. Miss Berta Taylor, you may take it away.
Good afternoon. Good afternoon. We are so excited today for this kickoff. Earlier today, like Duke said, we have had a great time. I know that headquarters have went beyond. So today, this afternoon, Head Start team is so excited because one thing about our Head Start team is all about working with our families and children. And they are so excited to come aboard. I have been with the Get Covered for 9 years, and I have worked with Healthy Kids for 3 years, and we brought the Head Start team aboard. So the first thing that we want to talk about with this kickoff is talking about how we want to share with our families and children as a group, as a whole, with the community. We don't just want to talk about the Medicaid and the CHIP. We want to serve the families, not just the children, but as a whole, we can refer our families over to Get Covered. Get Covered is has really been helpful down through these 9 years. And now that we're partnershiping with the Head Start team, this year, the consumers will have more plan choice, and we have more plan choice, which could continue to benefit from lower costs for President Biden with the America Rescue Plan, making it easier for quality, affordable healthcare coverage. So when we partnership with our families, we're able to refer them to the ACA, but mostly the Head Start team has been working with the Medicaid and CHIP program, which is the Healthy Kid. So I'm going to let Miss Tish Dean talk to you about our Head Start program, where they have always talking about pretty much what the Head Start program does for our families, for the families, and most of all the children. So Tish will tell you about our Head Start team. Take it away, Miss Tish.
Good evening, everyone. I'm so glad to be here on tonight as part of the kickoff Get Covered.
Can't hear you, Tish. Unmute you.
I did. It's unmuted. Hold on. Can you hear me?
Yes, ma'am, Tish, we can hear you.
Okay. Everybody can hear me. Okay. So basically, I'm Tish Dean. I'm an assister and now a navigator. I live in Lafayette County, but I work in Marshall County. I'm looking forward to assisting the consumers in securing coverage and trying to help them live healthier lifestyles. I have worked for ICS for 16 years. And once Head Start was invited to partner with Oak Hill, most of us came on in February of 2021. We began by gathering information on surveys and trying to reach out to our families to get a feel for who wanted assistance with Medicaid and CHIP, or if they had family members and we wanted to make a referral for getting coverage through the Affordable Care Act. In September of 2021, all of the Head Start assisters completed and passed the federally mandated navigator training and became navigators. So that means we can assist you with our families and people in the community with getting plans with the Affordable Care Act over the marketplace. Head Start has ICS Head Start has been around over 50 years. We have 20 Head Start centers in 14 counties. And those counties are Benton, Clay, DeSoto, Grenada, Lafayette, Lowndes, Marshall, Noxubee, Oktibbeha, Panola, Quitman, Tallahatchie, Tate, and Tunica. And at Head Start, we try to focus on the overall well-being of the child, because a healthy child learns better. If they have a toothache, they can't focus on you, and you can't teach them what you need to teach them. So health is a part of our overall head plan for the children. Good health, medical home, dental home. Head Start requires, the Office of Head Start requires that each child get an annual physical and dental exam. That's just part of the Head Start mandates. So with that, a lot of times we will find out when it's time for them to get those physicals and dentals that they're no longer covered on the insurance. So we try our best to encourage them to get back, go reapply, go do this. Well, now, a lot of us are able just to help them with this process. And they don't have to just go reach out to somebody or feel like they're alone with trying to get everything back on track. We can try to help them. And that's the wonderful thing, especially for children that age. If you start off at that age with coverage and going to the dentist regularly and getting your the well child visits and things like that, I feel like it continues. It's a good chance that it's going to continue throughout the rest of their life if they get it started really early. And for those, we do have some children who do not qualify, or for whatever reason don't qualify for Medicaid or CHIP. And Head Start does offer some financial assistance to help them pay for those physicals and dentals and things like that. But the majority of our children, about 85%, do report having Medicaid and CHIP. So that's a wonderful thing. I would like for our Head Start family to be able to focus on helping the whole family have coverage. If that parent is really interested in coverage, they're probably going to be more likely to make sure their child's coverage continues without a break, and they never go without coverage. And we try to explain to them, the basics, things that come with the insurance, the CHIP and Medicaid. And now we're able to kind of explain some of the basic things, preventive measures that are offered through the Affordable Care Act, if they get a plan through that are part of the basic requirements that the insurance plans have to have now, because a lot of people just don't even get the basic checkup, let alone treatment and exams, tests that they need and things like that. So we want to address the family and the community as a whole. That's what we would like to do now that we have the opportunity to help them in this way. We also Head Start over the years, different places such as Aaron Henry and North Mississippi Primary Healthcare and Northeast Mississippi Healthcare, and those are places that I know Aaron Henry is a federally qualified health center, and I think those other ones are too, where if there is just no coverage that they can get, they also work with us, and they accept our purchase orders, and we can send children there and get a reduced cost and everything like that. So when that child transitions out of Head Start, if they still don't have coverage, they at least have a start at a place that they can get a discounted rate just to continue the basics if they need it. So we just look forward to continuing to work with the families. We look forward to trying to help them. Because we've just come on and gotten navigator qualification certification, there's still a lot that we have to learn. And the training was thorough. We worked hard to get past that, complete that training. It wasn't just easy, but we did it. And so now we just want to learn, and we want to do the best we can to help our families and our communities. So that's our goal.
All right, Ms. Tish, that's just great. Like we said, that's the main thing. What we're trying to do is assist and help our families, because that's our number one goal. And with partnershiping with the Head Start team, this is going to make it even better because we doing abroad. We're not just doing it right in one area. We're going all over Mississippi. We taking this telethon to just higher growth. That's what we want to do, because this is actually, like Pastor Montgomery was talking this morning about the faith base. It's all about that. It's ministry and need health insurance. There are 5 factors you need to know. I know that Pastor Montgomery talked about this morning, but like we say, this is winding down to the end. And for open enrollment on the healthcare marketplace began on November 1st, which is today. This has been a great telethon. And it will last until January 15th for our healthcare.gov. Beat the rush, sign up early. That's what we're here for. We're trying to get the word out. And this telethon, I think, is just awesome. I can't say anything, but it's awesome because it's all about networking. It's all about getting the information out, sharing the information with our families and our children. Not, like I said, not just the Medicaid and the CHIP, but as a whole, we want to serve our families. So this networking is awesome. And we're gonna bring Laura Roger up, and she's gonna share some information with you of what has taken place during the time that they came aboard. Go get it, Lori.
Thank you, Ms. Taylor. Good evening, everybody. I am super excited to be a part of this team. I am Team Head Start.
We don't know what happened to Miss Lori, but that is all right. We're going to bring her back up in a minute. We know that technology is technology, and it does what it does. We're going to bring Miss Lori back up in a minute. We loving this Head Start team. I don't work for Head Start, but I love Head Start. Y'all know I'm a product of Head Start. Believe it or not, I am a product of Head Start. As a 5-year-old, I entered the doors of Head Start. I think the Head Start in Hernando at that time, it might have been called DD Bullet. I don't know what it was called. It might have been Bingham or something. I don't know. Bingham Head Start. But anyway, entered those doors, a little old 5-year-old, already knew how to read. My mom was just one of those kind of moms. But what I had an opportunity to experience from Head Start was to further assistance with all those health screenings that children have to have, learning those other basic social skills that little children need to know before they start first grade. And I said all this to say that we know Head Start provides wraparound services. And I'm just filibustering, talking until Ms. Laura comes back on. But wraparound services. So one of the wraparounds, or two of the wraparounds that they're adding right now, that they have added rather, is this access to health insurance. And it is so important. And I am so happy and thrilled that we have the Head Start sisters working with us as navigators for the Affordable Care Act. You can reach any of those folks from the Head Start office. If you don't know the phone number for the Head Start family service worker in your area, you can call our headquarters office at 662-298-3584, and we can make sure that we connect you with somebody in that Head Start center who can help your child get enrolled. And again, it's wraparound services. Medicaid and CHIP obviously is year-round. This big push today is for the first day of open enrollment for the ACA. And of course, as Tish has said, you have your federally qualified community health centers. There are 90-something federally qualified community health centers across the state. I believe it's 90-something. It's a whole bunch of them. So there's no reason for a person to be without health care. And I think Ms. Tish said that Head Start will even refer you to a center where the family, not just the child, but the whole family can get coverage. Why is the ACA important? Why is this coverage important for families? We know that the lack of insurance can cause people extreme financial hardship. How many people have you all known that have gotten sick, lost their job, didn't have insurance for themselves or their children, and their whole way of life had to change? Healthcare can be expensive. In the hospital, sometimes one pill is $300. So imagine what it's like if you don't have coverage. So we want to start these families out while they're raising these babies to make sure they got the coverage they need. Think about all these children that go to school and get all these injuries in school. Let's say they transition out of Head Start and they're first graders and they sliding down the jungle gym and there goes a broken arm. Or maybe they're a little bit older and they're playing basketball and there goes a broken toe. We were talking in the office here about broken toes a while ago, and you got to take them to the doctor. Here you go. Those are expensive costs that health coverage can take care of. So we here at Get Covered Mississippi want to help families get what they need. www.getcoveredms.org. On our phone number 662-298-3584. We are here Mondays and Tuesdays 9 a.m. until 5 p.m. Wednesdays and Thursdays from 9 until 7, Fridays from 9 to 5, and Saturdays from 10 to 1. If those times don't work for you, if you don't want to come in, perhaps we have virtual opportunities, whether you have somebody from Head Start helping you or somebody else that works on our team. We are in this together. All righty, let's see if Miss Lori is back on. Hello, Miss Lori. Laura going once, Laura going twice. Okay, technology does what it does. All right, who's next, Sister Berta?
Abigail.
We have Miss Abigail. I hear her.
All right, Miss Abby.
I hear her, and she is live and living color in the building with us.
So sorry. What happened is I had glitch with the system, and I had told them that I was going to do all the talking if they wanted me to.
Let me find Miss Abigail. Oh, let me bring you up on screen, Abigail. I don't see you, darling. Oh, there you are. There you are.
Okay.
I see.
Yeah, I
get
had
myself off the screen. I don't like the screen. It's on yours.
Okay. Oh, I don't care for it either, but okay. Yeah, I am Team Head Start as well. Had a directors meeting about we were starting up the Affordable Care Act that it starts today. you know what I'm saying, opening for to apply for
Open enrollment.
for open enrollment. That's it. We were I let them know there was open enrollment. So I also emailed all the centers. And when I emailed all the centers, to let the center directors know that we have open enrollment for families that need insurance. So hopefully, I didn't hear anything back today, but I emailed them this afternoon after I had spoke to Miss Lottie. So hopefully we will have feedback from parents and, you know, and provide them with health insurance, because a lot of families do not have the health insurance coverage that they need. So hopefully we will get a lot of feedback and parents will buy into Affordable Care Act and can afford to get Affordable Care Act as well. So I just wanted to let you know that. I am so sorry that I could not log in at first. I had issues. I went from my laptop to my cell phone, back and forth trying to get on. So thank y'all for being patient with me, okay? All right, thank you.
That is just super. Thank you, Miss Abigail. And we know about technology problems. That just happens sometimes. It does. So you have notified the center directors. That is fabulous. So that means families, Head Start families. If you are watching, your center director is going to put some information possibly in the hand of your child and send it home with your child. So know that that was sanctioned by Head Start leadership and that we have a great relationship with ICS Head Start that get covered Mississippi, and ICS Head Start is working together to provide these wraparound services. And I'm looking at the chat and I see another one of our navigators said that she's a product of Head Start as well. So we got Sister Jefferson and niece who says she is. So y'all need to give us a hand. We're some Head Start babies. Who else on the call is a product of Head Start?
I am a product of Head Start as well.
Miss
I am too as
Abigail,
well,
Miss
Lottie. And I forgot to tell you, I forgot to also tell you that our center directors communicate with our parents through Remind 101. That's the app that they communicate with them with. So they're going to send that information directly to the parent. They won't be putting anything in the child's hand.
Wonderful.
So,
that's even better.
So
parents, if you're watching,
right.
You heard it live and in living color on Facebook from us. Then you're going to get it on your phone from your center director. And you might even get it again from whoever your family service worker is at your Head Start center. So that is 3. Okay, 111 right there. I won't get churchy, but it's 111. So y'all know what that means. So please use this opportunity to get enrolled. All right, I heard somebody ask about affordability, and then I want somebody else to jump in. I'm not going to talk for this whole telethon. We got almost 30 more minutes, but I heard somebody mention affordability. The Affordable Care Act is truly affordable. Now, this is how it's affordable. Parents, I hope y'all are listening. Everybody else across the state, I hope you're listening. And we've said this all day, but I'm going to say it again for the ones in the back. All right. Let's say you make a whole lot of money and you don't get a subsidy. That's okay, because probably you can pay for the coverage. You would rather pay for the coverage than pay $50,000, $60,000 for a week in the hospital if you get seriously ill. It comes out in the wash, okay? Now let's look at the other end of the spectrum. Families that have a very low income. They don't get any subsidies. And what I mean by subsidies is when the government assists the person with their premium. It can be something called a cost saving reduction, or it can be an advanced premium tax credit. Families, that's why when you talk to your Head Start family service worker who happens to be a navigator for Get Covered Mississippi, you're going to have a little bit of a conversation about income, because that's how the government determines what you get. They have a formula. We don't make the decision. Head Start don't make the decision. Healthcare.gov. crunches those numbers electronically to determine how much out of pocket you have to pay. Do you guys know that there are some families now that have a premium as low as $50? Yeah, that is absolutely positively phenomenal. And people in previous years who did not get good cost saving reductions and they felt like it was too much money, guess what? If they apply now, the circumstance has changed because of the recent act from President Obama, the rescue and recovery. That's the result of all of this pandemic condition that we're living in. We need a rescue because some people lost their jobs, some people's income was diminished because of the pandemic, and then we need to recover financially. That's why he did that. So just because you may have applied in previous years and you didn't get enough reduction, try it again. And for those families who don't make enough money, guess what we're going to do? We're going to help you do an application for Medicaid and CHIP. If that doesn't work out for whatever reason, or if you choose not to, guess what? Ms. Tish talked about it a minute ago. Federally qualified community health centers. And somebody asked me, can you go to a federally qualified community health center if you have insurance? And the answer is YES, yes. Lots of people go to federally qualified community health centers who have insurance and who have means to pay. And guess what happens? That money ends up being a cushion or a supplement for the people who can't pay. That's why they can offer services at low cost or no cost. I see Miss Lori Rogers is back. Lori, you are, even though your camera's not on yet, you a sight for sore eyes. Miss Lori, will you come on? I'm gonna play like this is The Price is Right. Lori Rogers, come on down.
I'm coming on down. Good evening, everyone. Before my computer shuts off again, I am thankful and grateful to be a part of Oak Hill Regional CDC. As Tish said earlier, I am part of Team Head Start. We signed up in February, and we have been going strong ever since then. We are medicated sisters. We are now navigators. And Head Start is all about children and families. So this is an extended part of our work, is making sure our families are covered. And we're not going to only just do our Head Start families. We are diligently in the community as well, sharing this information, trying to get others to make sure everybody know what we're doing, what is available for them. Like I said, our goal in Head Start is our mission is children and families. So this is just an extension of us, of what we're doing. I am assigned to the Tate Marshall area. I am looking forward to helping more families. I'm looking forward to learning more and how I can better assist families get the health coverage they need.
Oh, wonderful. That's great. Thank you, thank you, thank you. She said she is Team Head Start. Anybody else want to talk about being Team Head Start? Who else is a product of Head Start? Anybody else on the call other than Sister Jefferson and Sister Tish and myself? Anybody else?
I was too old. They started right after the year.
Y'all hear Miss Taylor? She said,
I was too old. They started the year after I went to kindergarten. So, but I am still a product of Head Start.
Absolutely. Absolutely. All right. I
Sister
want to
Lottie.
know, yes, who is that?
This is Sharonda.
Hey,
I was just going
Sharonda,
to say,
let me
I'm
bring
not
you
a
up.
product of Team Head Start, but my children are. And they are doing absolutely wonderful. My daughter is at Mississippi State in the biology field, and she's doing great as a product of Head Start. And my granddaughter, I posted a picture just an hour ago, and she's student of the month at Batesville Elementary, and she's a product of Head Start. So I'm loving Head Start.
Yes.
That is great. That is absolute. So getting a head start, truly a head start, makes all the difference because it gives you a step ahead that you may not ordinarily have. viewers, think about all the children that wouldn't have access to so many of these things if it were not for Head Start. All right, let's talk a little bit more about the ACA. Do you all know that the ACA does not have a penalty for people who do not have coverage? I don't see why somebody wouldn't have coverage, but that penalty has been removed. So isn't that a wonderful thing? All right, and we have locations all across the state, all the way from the tip top of the state in DeSoto County, all the way down to the coast. We are helping people enroll. Now, January 15th is the last day of open enrollment. Let's look at these key dates. If you enroll by December 15th, you will have coverage by January 1st. If you enroll after then, you will have coverage by February 15th. All right. So remember those dates. All right. I had a question in the chat about what if somebody quotes the wrong income. Let's say they go see Ms. Lori down at the Coldwater Head Start. I believe it's called the Glenmore Head Start Center, and they estimate their income wrong. I'm gonna make up a good example of one that I've seen. Let's say it's somebody that does hair, and they, they never really know whether it's gonna be feast or famine for doing hair. So they do hair, and they estimate it too high on their income when they did their application. So they get those cost saving reductions based on that higher income. So at tax time, they go to do their taxes, and oh my gosh, the pandemic hurt their business. And they made $10,000 less than what they thought they were going to make. Guess what happens? They sit down and with their navigator, and that navigator helps them read through a form called a 1095-A. That doesn't mean anything to you today, but when tax time comes, it will. Now, we are not tax preparers, but what we do is we help you reconcile that 1095-A to the actual income that you had. So guess what? That person made less income. Don't you think they're going to get some money back? Absolutely, positively, because their premium was higher than it should have been. Then, of course, the flip side of it now is the opposite way. If you estimate too low and you make more, you may owe the government some back, but we don't think we're going to go there. We're going to try to help everybody estimate it as accurately as possible. We assist you if you need to report a life change. Let's say your income does change significantly, or maybe you get married or have a baby, or God forbid somebody passes away, or there's a divorce, or any of those things. Or maybe you move. Maybe somebody in your family moves from Tennessee to Mississippi, and they had coverage in Tennessee. They need to get it in Mississippi. Those are life-changing events. We can help with all of that to make sure that folks don't lose coverage. We even help people understand how to contact their insurer to pay their insurance premium. Now, your premium is what you pay every month. Okay, your copay is what you pay when you go to the doctor. And we've already said that some people get low premiums. Some people get it so low. I'm reminding myself of the Kroger commercial. It's so low that they may have pretty much a zero out-of-pocket expense. Y'all, that's phenomenal. Absolutely phenomenal. Again, this is a production of Get Covered Mississippi. We are under the umbrella of Oak Hill Regional Community Development Corporation. And everybody sees my sign back there behind me, www.getcoveredms.org, 662-298-3584. We are here every day to assist, and it costs you absolutely nothing. We will assist you in person, or we will assist you virtually. If we are in person, we're going to treat you well. We're going to treat you nice. We're going to show you the love of Christ. But guess what? We're going to be masked up. And we might have a plexiglass shield between the two of us, but that's all right. We're going to stay safe and we're going to provide the service that you need. All right, let's go back to Team Head Start. Team Head Start. Who else from Team Head Start wants to talk to us this evening? Miss Catelli, are you on the call? I hear that Catelli is moving and shaking down in Oxford. Catelli, I hope you can come on camera. I'm gonna ask you to start your video, ma'am.
Hello there.
Hi, how you doing?
I'm well. How are you?
Doing great, doing great.
I am Catelli Ramsey. Been a part of Head Start for 16 years. Been a part of Get Covered for 1 year. In March it will be. And I'm just here to say that it has been a great experience. Another way to network and get out there with the people. Another way to mission with the people. I do realize, really believe that we are helping. I'm in Lafayette County, Oxford area, and at this moment, most of our children, well, I would say 99% of our children are covered with Medicaid. The ones that are not covered are the ones who were not born here, but we are working on getting them some type of assistance as well. So everything is rolling along pretty good with that. I'm grateful to be a part of such a wonderful thing, and I hope it continues, and I hope to be able to help as many people as I can along the way.
All right.
All right, super, yay. Kudos to Team Oxford. Absolutely great. I love the point you made about people that are not born here. Guess what, viewers? We know we have people that have citizenship that is undocumented. And if a parent comes in or a relative comes in with that person and they're not applying, we only ask for information from the person who is applying. We are not going to endanger anyone who is here in an undocumented status. So we only need the information of the one who is applying. All right, keep that in mind, viewers, as you're watching, because we know we are a melting pot in the state of Mississippi, just like every other state. And we want everybody who's eligible for coverage to get their coverage. And that's what we're going to help you do. All right, let's talk a little bit about using coverage. I think Ms. Taylor talked about the 10 essential benefits a moment ago. That is your wellness checks, the mammograms, all the basic care that is involved in just day-to-day trying to stay healthy, because the ACA is designed as a stay well insurance. You know, we think of insurance as being only for when we get sick, but this is to help us stay well. And I want to share with you all the 10 essential benefits. I know Ms. Taylor already said it once, but I'm going to say it again in case anybody missed it. I think Brother Duke is going to help me with them. And he's going to bring them up on the screen. 10 essential health benefits that come with the ACA. You know, we want to know what we're getting. So if you can see what's behind me, this is what is covered. Ambulatory patient services, emergency room services. All right, guys, the emergency room is not your primary care, but sometimes the emergency room is necessary. Hospital stays, pregnancy, maternity, and newborn care. And we know the other coverage for that is always gonna, we're always gonna encourage our families to apply for Medicaid CHIP. Those who qualify can receive that. Also, mental health and substance use disorder services. Our mental health and substance abuse disorders, yeah, that's part of our health. You know, we are a three-part being: mind, body, and spirit. So coverage for mental health is so important, and that is part of the ACA. Another benefit is prescription drugs. And what we tell families, you know, there are 3 different carriers that they can choose from. And one plan may be cheaper than another one. So we help folks to navigate to the best plan for them. We don't pick the plan for them. But one thing you got to do when you're choosing your insurer is make sure your drugs are covered. We talked about this earlier. We had a family member today who went for a cheaper plan. Actually, she wasn't doing healthcare.gov. She was Medicare, but it's the same concept. Went for the cheapest plan and did not look at the drug formulary. And a drug that she had to have was not covered because she didn't read the plan carefully. She ended up paying $300 for that drug a month. That was in addition to what her regular plan was, her premium. If she had only read, she could have still got an inexpensive plan, but made sure that her drug was covered. So prescription drugs are covered. You just got to make sure you pick the plan that covers what you need. Pick the plan that your doctor is part of. Also covered is rehabilitative and habilitative services and devices. All right, walkers, wheelchairs, going to stay in a rehab facility, those types of things. Lab services, you know, when they come at you with the needle, they get about 7 tubes of blood and they send it off to Dracula and he does whatever he needs to do with it. And and then they send your results back. That's covered by the ACA. Okay, preventive and wellness services. And y'all, that's a biggie for people of color. We're in Mississippi, and I got to say this because a whole lot of us in the state of Mississippi, we got to do better as people of color. And I'm talking about brown and black folks. Brown and black, that's our African-American population, our Hispanic population. I'll even say our Vietnamese and Asian population. Preventive services. Oftentimes, other ethnicities get diagnosed with illnesses more than we do, with certain types of cancers. However, we die from those illnesses more than they do. So that's out of whack. If they get it more than we do, but we die more from it, guess why? It's because we don't utilize preventive and wellness services. Prostate checks, pap smears, mammograms, all those things that keep us healthy. And then finally, pediatric services, making sure that our children get the care they need. With this Head Start team on board, they know that good health starts in childhood. Good health starts in childhood. I'll say that again. Good health habits. Good health habits start in childhood. All right, those are the 10 essential benefits that are covered by every plan that is a part of the ACA. All right, and let's look at terminology. The ACA is the same as Obamacare, is the same as marketplace coverage. It is the same. And all those plans have the 10 essential benefits. Let's go back to Head Start again. Is there anybody else from Head Start that wants to come up and say 2 or 3 words to us?
Well, Sister Mina,
Good evening, everybody. Good
let me
evening.
piggyback on
I'm
what you just
Lee,
said
and I'm also
with the
team.
hold on, we got
Hold on, we
talking at one time.
Yeah, 2 people
Let's
talking
go to
at
Miss
one
Taylor,
time.
then we're
Let's
gonna
go
come
to
back
Miss
to Miss
Taylor, and then we're gonna
Sharonda.
come back to Miss Sharonda.
Okay. I just wanted to piggyback on what you said about the pregnancy. We have a pregnant mom program in the Head Start. It's like early Head Start. Well, we have a pregnant mom program. And if we know that someone is pregnant, what they do is they do an application. And once the baby comes, they do another application. So it's like you have 3 steps in one. You start out with your pregnant mom program. Then you go into your early Head Start program. Then you go through a process with your regular Head Start. So we start when they're like 6 weeks old. And then actually before 6 weeks old, while they're in the mom's area, we start there. So that is one of our
In the womb, is what she said. In the womb.
So that is our that's the preventive part where you start early. So you catch it early, and when something is going on, you can find out just with the pregnancy mom program. So I just wanted to touch base with that. Sharonda, you can go ahead now. Thank you.
Okay, Miss Berta. Good evening. I'm Sharonda Lee, and I'm also Team Head Start. As we said before, I'm here in the Panola County area, along with some other teammates, Miss Candace Shiga, Miss Nettie Brazel, and Miss Linda Lee. We are trying to help assist our families, not only just at Head Start, but in the community to obtain affordable health insurance because we understand, we know how important it is to have health insurance, like you all have said. We've heard over and over again, preventive care, preventive care. It is so very important. And beginning that routine of going to the doctor, not waiting until that child has a toothache or until that adult has a toothache. Start their routine care with going to the dentist so we can keep our beautiful teeth and not have, have these aches and pains. And in order to do that, we have to have insurance. So many times we lay there in pain because we don't have insurance. So it's a blessing that we do have this Affordable Care Act. So we're out here pushing, trying to get the word out that we are here to assist anyone that needs help with obtaining insurance.
Absolutely. Wonderful. Thank you. Thank you so much. Starting early in life. Both ladies said that beautifully. Starting early in life. And I think going to the doctor and having coverage early and not seeing medical situations as a stressor is good for children. So when they become adults, they're not afraid of the doctor. They don't tense up every time they hear about a medical procedure or every time they hear about insurance, because they came up in an environment where you knew that going to the doctor did not always mean you were going to end up in more pain. It meant you were going to get something to keep you from getting any sicker. I see that Miss Bettina Campbell has joined our call, and I did not ask her for permission to bring her up, but Miss Bettina is our one of our navigators, and also she's one of our Medicaid and CHIP assistants as well. But she is a licensed master's level social worker, just like Ms. Taylor and several of the other people that are on this call tonight. And her expertise area, one of her areas of expertise is mental health. So Ms. Bettina, if you can talk about the importance of having insurance. I touched on it with the 10 essential benefits, but if you can bring that in relation to our families, mental health and our families is so important. I know we talking about Head Start and the children, but all those children got a parent, a guardian, a grandparent, somebody who may be dealing with just life issues, and that does affect our mental health. Talk about that for just a moment, Sister Bettina. I'm gonna try to bring you up on the screen if I can.
Thanks for the sabotage, Sister Lottie. But no, no, mental health is extremely important, and we can talk about it from the perspective of the parent, but also the children. Sometimes we forget about children become depressed or they get stressed out, and with this COVID, a lot of our children are finding themselves with high anxiety issues and depression issues, and just not being able to interact. And so having them back in school is a good thing, but we need to keep an eye on them. And parents, especially going into this holiday season, we've had so much death and dying with COVID, and even under normal circumstances, which can make people depressed and lonely during this time. So it's important that you watch your children if they're seeming like they're more withdrawn than they normally are. You may want to try talking to them, and if they indicate that something is wrong, or if they don't know how to express it, but you know that something is wrong, they're not behaving like they normally behave, and is worrying you, you may want to reach out to the school social worker, to the school nurse, and ask them to do an evaluation. And if you don't feel like that they can provide you with what you need, you reach out to your own family physician, because it's so important. Mental health is just as important as your physical health. And if your mind is not right, then your body is not right. So again, make sure that you are taking the steps that's necessary for you and for your children to be able to have mental well-being. And don't blow it off. Don't think that children, because unfortunately, children do commit suicide also. So don't just blow off something or think that it's not important. Realize and recognize what you're seeing. And if you're questioning it and you turn out to be wrong, that's okay. It's better to be wrong than to be sorry. So if you have issues, even as early as 6 and 8 and 9, we've had a lot of, unfortunately, during this COVID time, we've had a lot of young people that have actually completed suicide. So we don't want to play with that. We want to make sure that we are watching our children. We are doing what's necessary. And if your heart tells you, or I'm going to say gut tells you that something is wrong, it very well may be. And so reach outside yourself, reach outside your family to those professionals. And sometimes, we don't want to talk to professionals. We're scared, or we don't know the people to talk to. Reach out to your clergy. Ask them for assistance. Ask them for guidance. And I'm sure that if they don't know, they will have someone that they can reach out to also, or call our office, and we'll be happy to make sure that, ask for me, Bettina Campbell, and we'll be happy to make sure that we refer you to the appropriate people, because sometimes it's important, well, I was gonna say all the time, it's important to talk to someone. If they don't look like you, they at least have they are competent and have the humility to understand your culture and be willing to work with you and make sure that you get the help that you and or your family needs in this time.
Thank you, Sister Bettina.
You're welcome.
Thank you.
You're welcome. I also wanted to say to parents too, women that are pregnant, sometimes we don't think about the fact that sometimes our hormones are off, and those hormones can make us have some mental health issues, and either before or after pregnancy. Postpartum depression is real. Again, if you find yourself not feeling yourself and being tired, being anxious, being afraid, being depressed, and just not wanting to take care of yourself or do the things that you usually do, then you may want to have a discussion with your doctor so that they can know what's going on and they can help you. Our hormones play some tricks on us sometimes. So just make sure that you are getting the help that you need for yourself and for your newborn.
Thank you. Excellent information, Sister Bettina. You have shared, I think something that speaks volumes, particularly at this particular juncture in our world with all of this COVID and so many other things that are going on that just throw people off. So thank you. All right, guys.
I also want to say too, when we're talking about pregnancy, that Black mothers are dying more often than any other mothers in terms of big pregnancy. So make sure you get a doctor that you feel comfortable with, and that you see that doctor, and that you stay under the care of that doctor, so that you and your baby will have good health. Because we don't have to die. We just have to do that preventive care.
Mm-hmm. So true. And coverage is the key.
Amen.
Get covered today, the first day of open enrollment. 662-298-3584. You won't get covered tonight if you call that number, because we're about to leave, but we do have people available tomorrow and Wednesday and Thursday and Friday and Saturday. And like we said, we will make it as convenient as is reasonably possible in this COVID environment to help people get covered. www.getcoveredms.org. Again, this is a production of Oak Hill Regional Community Development Corporation. Get Covered Mississippi is one of our organizations that falls under that umbrella. The other, of course, is Healthy Kids Mississippi. Both of those deal with insurance, health care coverage. You know, we've been talking about the faith-based community a lot today. We know we get assurance based on our faith. But while we're in this body, we got to have some insurance to help keep us healthy. All right, our executive director is Dr. Michael O. Minor. I am Lottie Minor, your project director. We've had with us today so many of our team members. Brother Thomas Duke Robinson does our technology and our metrics. Ms. Berta Taylor is our Head Start liaison, our lead navigator for the Affordable Care Act. Ms. Annie Jefferson is our finance administrator. Ms. Bettina handles all of our wraparound services that we offer, as well as being a Medicaid assister and a navigator. Brother Clarence Campbell, our education coordinator. Pastor Bernard Montgomery is one of our regional directors. Ms. Brenda Wilson is also. Ms. Loretta Miller. We've had Ms. Kathy Garrett. We've had Ms. Jacqueline Moore. And I feel like I'm leaving somebody off, so I'm going to stop calling names, but y'all get the picture. At the folks from Boat People SOS down on the Mississippi Gulf Coast. There is Dr. Minor. He is going to close us out tonight. I'm going to go way back and say we're going to sign off in a minute, y'all. Some of y'all don't even know about signing off, but y'all remember when the TV used to go off at 1 a.m. and you had a black screen done. Brother Duke don't even remember that. Well, that's what we're going to do in a minute, viewers, but we are so happy, so glad that you watched our telethon. My husband's looking crazy. I made a funny, Dr. Minor. This is a telethon. We're supposed to laugh. but thank you all, Team Get Covered Mississippi. We appreciate you, to all of our viewers on Zoom, on Facebook, however you're watching.
All right. Thank you.
Resource chat.
Thank you, Lottie. Wow. It's something you get punch drunk when you've been around all day long. We started today.
Dr. Minor.
Yes.
Third Wednesday, Parent Resource Chat is a great resource. Hopefully, Head Start families, you're watching this on Facebook. Ms. Bettina Campbell coordinates that. We have different topics every week. We've talked about mental health. We've talked about COVID. We've talked about the vaccine. We've talked about bullying. We've talked about college prep. The topics just go on and on and on and on. But that is a great resource. We encourage you to please watch us. Then once a month on a Monday night, we have the Pat and Mary Show. Miss Pat Boga and Miss Mary Fenner talking about really Medicaid and CHIP, but then they talk about all things health related. All right, those are just two of the different productions that we have. Dr. Minor, it's in your hands, sir.
All right, now, Sister Minor, Lottie Minor, what your name is? Are you sure? Are you sure? Are you sure it's in my hands now? All right, thank you. I
don't have to go home, but Duke said we gotta leave here.
Look, everybody, we have enjoyed you all today. It's been a long day, but an enjoyable day today. We are excited about this first day of open enrollment. We're excited about Team Head Start. We started today at 9 a.m. with our headquarters, and Sister Matt and I got wrapped up and got into our vehicle and danced down to the church, and we were ready at 12 for Mid-South churches, and they did a great job. Everything set up with their banners and everything. Then 3 o'clock, we were under the auspices of Brother Duke Robinson, who made his debut as a very capable host with our team, Golden Triangle, and down the Gulf Coast and the Delta. It was great. And then we saved the best for last. We come out with Team Head Start. We're so excited to have them on tonight. Yes, we're excited for the work they're going to do. But all good things must come to an end. As we see behind our Team Head Start, together everyone achieves more. And that's what Team Head Start is going to do. This is their first open enrollment season. We're so excited that they're going to be able to help us provide wraparound coverage so that no matter where you are, whether you need to get a federally qualified community health center, whether it's Medicaid, whether it's the Children's Health Insurance Program, it's the Obamacare, whatever the case may be. We got you. So call us 662-298-3584. 662-298-3584. I'm going to be saying in my sleep. Sister Mine going to turn over and say, what you talking about? 662-298-3584. Just get that on your speed dial. And we're here to help you. But look, we're getting ready to go tonight. All good things will go to an end. We're getting ready to end the social media part of our telecast today, our telethon. We then again want to recognize the work of our project director, Lonnie Miner, and our board chair, who has been doing a very wonderful, and Sister Jennifer Garrett has been doing an excellent job as our board chair and our entire board directors, all of our staff. And again, this has been a production of Oak Hill Regional Community Development Corporation here in Hernando, Mississippi. This concludes today's OE9, Open Enrollment 2022 Kickoff Telethon. God bless you. God keep you is our prayer.